and in the south. So it's a matter of of culture also. I think, and this I think it's a good thing. Everywhere you go, for example, they have their own theme, or their own, for example, different type of greeting. And I think it's nice that this mix of, for example, greeting also on words, it gives, for example, this person a speciality, for example, and this also another speciality. But speaking of which, we will of course to our very esteemed guest here today also.
Because whenever we talk about greetings, Walid, one thing is eminent. Whether you're gonna say Hayakum Allah or you're gonna say Allah Hayyu or whatever greeting it is, you're gonna have your teeth flashing. And for that, you have to have beautiful teeth.
Exactly. And with us, of course, Dr. Mubaffar to provide us, of course, always with the beautiful teeth. First of all, Dr. Mubaffar, of course, dentist. Good morning. Welcome to the show.
I'm fine, thank you.
Doctor, our topic today, of course, is that child dentist. And we're speaking about that, for example, a child and take care of his teeth. I think it's important because mostly, for example, if a child, if he takes the wrong teeth out, for example, or for example, if he avoids brushing the teeth at a very young age, when he reaches, for example, into his youth, probably it will be a whole mess. Then he will come to you as a dentist, and then you will give him a very hard time also to fix these teeth, for example. So tell me about the first thing that child should be doing, for example, when cleaning the teeth, for example, how many times a day, what should I eat, for example, as of sweets. We know that they enjoy chocolate, the effect of chocolate. We know that also teeth, for example, falls down at a certain age. What should we be doing on it?
Thank you. Thank you for we are here in Saudi Arabian television channel too.
You're welcome.
We will talk about the tooth eruption for the children. The first tooth that erupts in the mouth of the children start when the child has 6 months. This tooth is the first lower incisors in down. Still the eruption of the tooth until 2.5 to 3 years of all of the patient of the child. We talk with the mothers, with the parents, that they must take care of their of the teeth of their child until from the beginning of eruption of the teeth. From this beginning, we talk. You see that if the child has washed his teeth from the beginning, he will know that it's important for him. And there is in Arabic language proverb what's called "Man shabba ala shay'in shaba alayh." That's meaning if the child from his the first age of his in the first age he brushes his teeth. He knows that's what's the importance of the brushing teeth. He will continue to prevent anything that can attack his teeth.
Good topics. Good topics. And when do you start, for example, on using fluoride to the child's teeth?
Okay. We will start from the use fluoride. The fluoride, we will make definition for the fluoride. This fluoride is a gel. This is a gel that we apply this gel on the teeth for the child. This give the teeth extra protection against the teeth decay. We start from two years of age of the child, for the child from 2 until 6. But if the child can't brush his teeth, it's better that the fluoride is in addition with the brushing the teeth. That's meaning it's not only make fluoride or application of fluoride without brushing. That's meaning we will make at least twice yearly. We make the fluoride gel for the patients. Sometimes there is some if the application of fluoride for the child make long time, will make some spots, white spots on his teeth, but it's not
So this is the over application of fluoride on the teeth.
From 2 years.
From 2 years. So if you start to see these white spots on the teeth, means that there is overfluoridation.
Overfluoridation, yeah.
So that means that you need to. But do you have toothpaste actually which do not have any fluoride?
Yes,
in
there
it?
is, yes. The
Non-fluoride
no.
formulas.
Yes, there is some toothpaste without fluoride. This is for this is for child, especially because some some children, you know, that swallow the toothpaste. It's will make toxic for his body if they swallow the toothpaste. For that, some brands of toothpaste they didn't make fluoride. But the fluoride, the original fluoride, we can see the original fluoride in the water, inside some milks. This is all contains the fluoride.
So how is it that some toothpaste could be contagious for us? I mean, could do harm to us?
No, I think the method how to brush the teeth give some problems for the teeth.
Right.
Yes, this is the method. Maybe all the toothpaste it's okay for the teeth.
So, like, you know, if you swallow by mistake while brushing some toothpaste, then you don't need to induce vomiting or something. It's all right. And
yes, but the child, you know, the child, it's very sensitive.
So it's important to use kids' formulas for the children.
Yeah.
The toothpaste which are specially designed for the children, not only because the tubes look pretty and colorful and cute, but also because of the formula itself. Now with this, Dr. Muzaffar, tell us a little bit about some of the wrong eating habits of the children which do affect their teeth.
Okay, the children, he is not another person. He is a person, but some habits in eating, for example, for the chocolate, for the sweets, especially at night before sleeping, will make increase the probability for make decay for his teeth. You know that he must wash his teeth before sleeping, because the bacteria has increase of action when he is sleeping, because the saliva. You know, the saliva that has temporal system. That's meaning try to make the acidity of the oral cavity is low. For that, the bacteria can't attack the teeth.
The bacteria can also attack the teeth itself. But also, doctor, there's a habit going on, let me say, with the kids in general, that sometimes, for example, they put their fingers in their mouth. They start, for example, sucking on it or biting on it, for example. Does this also have an effect in the future also on the teeth itself?
Okay, we will talk about this point, but I wanted to talk about the eating habits for the woman, pregnant woman, because it's important for her
yeah, sure.
developed child. We will talk that it's important for the pregnant woman. You know that the pregnant woman has a high risk on teeth attack, because she has the hormones terrible. Yes, in her teeth. But it's makes sometimes a problem for the teeth of his child. You know that it's not allowed to take some antibiotics that make some coloration for the teeth of his child. For example, what's called tetracycline. It's not allowed to take it the pregnant woman. Okay, and we talk about that's the pregnant woman need to increase her daily amount of calcium. Daily amount of calcium from she can eat some cheese, milk, and another thing, that's the vitamin K. The vitamin K, it's important for the mineralization for the teeth and the bone of the child. We can find the vitamin K also in the fish, especially salmon, and the eggs. For your points about the sucking, that's called. This some problems for the patient. You know that some studies, they said that the child, when he is inside, that's meaning not yet finished in his maybe.
His mom's stomach, you mean, inside the...
No. Before the pregnant woman delivered, he stuck his thumb inside inside his mother body. When he's fetus, still sucks his finger. And still with him this happens because you know that he will take milk from his mother. Still in his imagine that he must suck some thumbs. But the problem is when sometimes we talk about that this habit stop in 4 years of age. But if this habit still until from 6 to 8 years, this will make some problems for the child. For example, can make terrible for the shape of the oral cavity or dentition. We talk about the alveolar prognosis.
It can make issues, a problem for what exactly? The dental shape?
Anterior, yeah, dental shape, oral cavity shape. That's
Really?
meaning make prognosis. That's called prognatism. Alveolar prognatism.
So just sucking on the mouth itself, on the hand itself, could affect the teeth?
Yes.
Okay.
And we call anterior open bite. That's meaning his anterior teeth can't make contact. There is a space between the anterior teeth and make prognatism. That's meaning it's go in the front for the teeth. You know that for the treatment of this sucking, I think there is some psychological problems. That's meaning the child he needs comfort, calm for the parents. They talk with him about there is something wrong in the life for the child. That's meaning psychological. They said that's. For example, I think that 80% of the problem of sucking is psychological. Then there is some studies, especially in America, they said that they give the patient, they give the children some piquant substances. They put it in his finger. When he will suck, the thumb he will not be comfort with that, and his mind will be that's meaning
drifting towards something else. Yes, yeah, it's similar for nail biting as well, that they apply a kind of a nail tint on your nails, and you feel like, you know, you have like as if you have bitten into a chili or something. It's really chilly. I mean, not when you would taste it, but the sensation that comes on your tongue when you're biting your nails. So similar way. But now with this, tell us, Dr. Mutaffar, given if children have any complications with their teeth, with their entire oral cavity, let's say, what happens when a child is brought into a clinic of a doctor like yourself?
Okay.
I mean, especially because, I mean, like, you know, the more you're asked to do something, and this happens mostly to children. I mean, it happens to adults as well, but children too. They usually do what they are asked not to do, and they don't do what they're asked to do. So children, as soon as a child comes and sits on that horrible looking dental chair, I mean, I'm so terrified of it, and I've always seen it as a horrible chair. But nonetheless, when the child sits on it, and then the dentist come with a mask on his mouth, open your mouth. I mean, nobody wants to open their mouth, actually.
I think that almost of the people, they hate the dentist, even the child or the adult. But for the child, it's important to protect his teeth. This is the first step in treatment, the prevention. The second, if the child has some decay, we will talk with him about in a nice way how to talk. Open your mouth. Okay, I will buy for you something if you open your mouth. If you, this is for. I think 60% for the patient, they can accept that. There is another thing. There is a laughing gas. This is a machine. that give laughing gas or nitrous oxide. It's called N2O in the chemical.
It's a sort of a drug, chemical drug, right?
Yes,
Laughing
there
gas.
is a drug, another. This is a Valium, another one. But for the laughing gas, this is the laughing gas. We can give it to the child and the adult. No problem for which age. This gas will give. We use it in dentistry. It's used in all the operation, but in dentistry, especially, we use it for its anesthetic and analgesic effects. These effects will give you some. That's meaning that the patient he will be as a tired. You can treat him and reduce the stress for you know that the dentist chair has
Makes a lot of stress.
yes.
Yes, that's true. Just by looking at it, I mean.
Yeah.
Very well said. Dr. Muzaffar Abu Zaid, of course, a dentist, and a very good one also. Thank you so much.
Thank you.
Hopefully also will not be terrified of your chair after you have just informed also this very good news. And I think before we end, let me say this interview also today, I'd like to thank you and a small advice also, for example, when brushing the teeth, cleaning the teeth, how many times a day, for example, do you advise the viewers to do it also, and how important is mouthwash, let me say, to the gum itself and to the teeth, to the tongue also, cleaning the tongue, how important it is also. And a very small brief, less than a minute, please.
Okay, we talk about that's meaning if you take care of your teeth, you will reduce all the problems that will become after that. Brushing the teeth, it's important three times at least daily. But if you
3 times a day.
3 times a day, yes. And you talk about the mouthwash. Mouthwash, it's important for the gums, for eliminate all the problems after brushing, and give a nice swallow for the patient.
Good job. Thanks a lot, Dr. Muzaffar Abu Zaid.
very much.
I'll be also stopping by your, let me say, clinic also soon enough, let me say, to check out also what's going on.
Okay.
I'll be
Welcome.
actually needing that laughing gas, you know what, because I'm actually the type of people who, for example, do get terrified when it comes to this, so make it ready for me.
Thank you.
Thanks a lot.
Great.
That was, of course, you, Dr. Muzaffar Abu Zaid, of course, a dentist here with us here today, and give us some great advices about what to take care of your teeth, and of course, to the child dentist in general. For any, let me say, also comments, requests, I'm going to get from Dr. Muzaffar Abu Zaid. Please feel free to send us, let me say, through, of course, our Facebook Saudi Morning Show, and of course, again, the Twitter, Saudi CH2, the email is saudimorning.ksa2@hotmail.com. We'll be more than happy to receive any questions or comments. Of course, with that said, Health and Medicine Report. After that, we'll be right back with another esteemed guest, so stay tuned.